The Patient Protection Affordable Care Act of 2010, also known as the Obamacare. The law provides numerous rights and protections that make health care coverage more fair and easy to understand, along with subsidies through premium tax credits and cost-sharing reduction to make it more affordable. The law was amended by the Health Care and Education Reconciliation Act of March 23, 2010. The law expands the Medicaid program to cover more people with low income. The law has three primary goals. Number one is to make affordable health insurance available to more people. Number two, expand Medicaid program to cover all income below 138% of the federal poverty level. It supports innovative medical care delivery methods designed to lower the cost of health care generally. The healthcare law offers rights and protections that make coverage more fair and easy to understand. The law requires insurance plans to cover people with pre-existing health conditions, including pregnancy, without charging more. It provides preventive care, gives young adults more coverage options, ends lifetime and yearly dollar limits on covered essential health benefits. It helps patients understand the coverage they're getting. It holds insurance companies accountable for rate increases, makes it illegal for health insurance companies to cancel your insurance just because you get sick. It protects your choice of doctors, protect you from employer retaliation. The law I would like to discuss is the coverage for pre-existing conditions. No insurance plan can reject you or charge you more or refuse to pay for essential health benefits for any condition you had before your coverage started. Once you enroll, the plan can't deny your coverage or raise your rates based only on your health. Medicaid and the Children's Health Insurance Plan, also known as CHIP, can't refuse to cover you or charge you more because of your pre-existing conditions. Pregnancy is covered from the day your plan starts. If you're pregnant when you apply, an insurance plan can't reject you or charge you more because your pregnancy. Once you're enrolled, your pregnancy and childbirth are covered from the day the plan starts. Your childbirth or adoption qualifies you for a special enrollment period. But there is also one exception on grandfathered plans. They don't have to cover pre-existing conditions or preventive care. Grandfathered plans are an individual health insurance policy purchased on or before March 23rd of 2010. These plans weren't sold by a marketplace. These plans weren't sold by marketplace, but by insurance companies, agents, brokers. They may not include some rights and protection under the ACA plan. Healthcare reform has affected every aspect of our society. There are many stakeholders, patients, doctors, insurers, politicians, and pharmaceutical companies, each with their own priorities. The healthcare cost continues to increase. Choices and accesses are limited. Electronic paperwork and documentations are increasing. Physicians are spending less time with patients. The affordable patients should have affordable, accessible, high-quality health care for everyone is an ethical goal. Everyone in the U.S. should have the opportunity to obtain the health care they need.